6 things you need to know before becoming a respiratory therapist. Students who are considering a path in respiratory therapy must understand 6 things before becoming a respiratory therapist, also known as RT. Number 1. What respiratory therapists do. A respiratory therapist, also known as RT, specializes in assessing and caring for patients who have respiratory disorders, diseases, and general problems in breathing. RTs work under medical supervision and as part of teams such as respiratory care departments, anesthesiology, or pulmonary rehab. Another area where RTs work is the pulmonary function testing, also known as PFT. If a patient cannot breathe properly on their own, a respiratory therapist will assist in the insertion of a breathing tube into the patient's trachea and connect the patient to a ventilator to induce artificial respiration. Some of the tasks that respiratory therapists perform: analyzing X-rays, managing artificial airways, counseling and educating patients, managing life support with said ventilation systems, working in a team of physicians to recommend therapies, administrating aerosol-based medications, lab work analyzing blood and sputum, performing tests and studies, checking vitals. Number 2. The work environment. Respiratory therapists work in hospitals. They can also be found in home care and pulmonary function test and sleep study laboratories. Number 3. Job outlook. According to the latest Bureau of Labor Statistics, also known as BLS Statistics in USA, employment of respiratory therapists is projected to grow 23% from 2016 to 2026, which they state much faster than average. The expected growth and demand for RTs in Saudi Arabia is projected to be similar. Number 4. How to become a respiratory therapist. To become a respiratory therapist, one must acquire at least a bachelor's degree. Respiratory therapy program at Inaya Medical College, also known as IMC, is dedicated to helping members of its community in Saudi Arabia achieve their dreams. At IMC, we offer several healthcare-related programs for our community to excel in healthcare and achieve top positions and higher job and life satisfaction. Number 5. Licensing and certification. Upon graduating as a respiratory therapist, students are eligible to take the licensing exam by the Saudi Council for Health Specialties, also known as SCFHS. Number 6. Qualities of the respiratory therapist. Keeping and collecting well-organized records of patients' condition. Problem-solving skills in order to evaluate patients' test results and symptoms. Working with doctors and in team-oriented environments requires interpersonal skills. Compassion is important so that therapists can serve as a support system for patients suffering from an illness. Because RTs work long hours in hospitals providing special care for patients, it is important that one have an enormous amount of patience. The ability to manage risk and capability to work well under pressure.